Hello everyone, today I'm going to be demonstrating how to do a simple surgical wound dressing change. So before we get started, I want to make sure that I've looked at my doctor's order, I've looked at the policy procedure manual, I've done good hand hygiene. Because I'm going to be coming in contact with blood or body fluids, I want to make sure that I'm wearing gloves. I'm going to ID my client using two identifiers, name and date of birth. And then for this procedure, I'll be using surgical aseptic technique. So the first thing I want to do is remove the old dressing and do an assessment of the wound. So here I'm looking at the incision line. I'm looking to see that the edges are becoming well approximated, that there's no areas that are opening up, that the sutures are all intact. I'm taking into account the location of the wound, the length of the wound, and then I'm also going to be looking at is there any redness, swelling, discharge present at the incision line. I'm also going to be looking at the outside of the wound, so the peri-wound skin, and I'm going to be looking at sort of the temperature, color, and looking for any signs of edema. If I do any palpation around that wound, I have to ensure that I'm wearing sterile gloves. I'm also going to be looking at the old dressing. So what kind of discharge is present? So is it serous, serosanguinous, sanguinous, or is it purulent? Does it have an odor? So old blood generally does have a bit of an odor to it, but it shouldn't be putrid or purulent or foul smelling. Once I've done that, and then I'm going to ask my patient about pain as well. If they're having pain, I should ensure that I give them something for pain at least a half an hour before the procedure starts. So this is going to go in the garbage. I'm going to take off these gloves. I'm going to, again, do some good hand hygiene. And then I'm going to put on my sterile gloves. So prior to actually taking off the old dressing, I had already set up my sterile field. Again, taking into account I cannot look away from the sterile field or walk out of the room. The field has to be within line of vision. I have everything sort of set out here, so I have my new dressing material here, the stuff that I'm going to be using for cleansing. I can take the drape that's here and I can place it next to the patient. So there's two sides to the drape. Sometimes. This one is paper on both sides with a plastic interior. I'm going to place it just next to the wound. And this is just going to give me an extra sterile surface if I want to place items. So the first thing I'm going to do is I'm going to grab my 2x2s that I'm going to use to clean the wound. So I'm going to put 3 in here. And I'm going to take them out and I'm just going to wring them out. I'll place them to the side. And then I'm going to start to cleanse the wound. So I'm going to start at the incision line because that's the cleanest part of this wound, and I'm going to take one swipe down and then discard my 2x2. I'm going to make the next one and I'm going to go alongside the suture line on one side and then do the same for the other side. Always want to keep your forceps down. Don't put them up. If you put them up, the fluid is going to leak down and onto your fingertips. Once we've cleaned, and we can go more on each side if we need to, I'm going to dry. So I'm going to take a separate piece of 2x2 and I'm going to go down the center and then down each side. Once that's complete, I'm going to put this aside. I'm going to grab my dressings. So I have a non-adherent that's going to go against the wound, and then the absorbent pads will go on top of that. So I'm going to put my non-adherent, and then my adherent, And now at this point, I don't have to worry about my hands being sterile because I'm done with the cleaning of the wound. I'm going to grab my abdominal pad. I'm going to open that up. And then just touching the outside, so the outside will have this blue strip. I'm going to open it up on either side and place it directly on top of the wound. So that's going to be my wound cover. Once I've done that, I'm going to take my tape and then I'm going to tape around the edges and then I'm all done. So once I'm done, I can go back to the patient record and I can document this in their wound care record, post-operative flow sheet, or interdisciplinary progress note.